So we've got for our grand rounds from today is going to be coming from our Neurodevelopment Intervention Science, IPC, where we've been focusing on early childhood language, social emotional development, and early literacy. And so with our focus in on early communication, I wanted to welcome Dr. Alfano, who's going to be speaking today about development of language, specifically with children who have hearing impairment who are coming from bilingual homes.
Awesome. Go. All right. Hello, and thank you for having me. It's really nice to see so many familiar faces. Hi, Bob. How are you? All right, so I'm here. I'm very thankful for being invited to talk about the research that I've been doing. I know many of you here in this room work with kids with hearing loss and have helped me find a lot of the kids that have been in these studies and that are continuing. So let's take a look and see. My disclosures are that I am employed by FIU. I am a full-time employee there, and the Alfano Center, which is my private practice. Some of you have been through there as well. Mm-hmm. All right. So my background, I am a speech-language pathologist. I graduated with my master's degree from FSU in 1998. So I always like to go back and say that it all started back in 1990 when I volunteered at the Debbie School. Right? I was in high school and I was learning sign language, and I wanted to see kids with hearing loss. So I came one day with someone who was doing a work study, and I met Lynn, who was a CF at the time. Very young. She was 18, I was 12. And you know, I asked her, I said, what is it that you do? Because I like what you do. She said, I'm a speech pathologist and an audiologist. I said, oh, okay, I'm going to do that. I want to be a speech pathologist and I want to work with kids with hearing loss. So I did. Right? And here we are today. So from there, like I said, I graduated in 98 with my master's from FSU, and then I came here to UM for my PhD in teaching and learning, and graduated in 2007. As far as the Alfano Center, my private practice, it opened in 2003, so we are 15 years old now. We provide SLP, speech services, and OT, and then more recently, things I've added are I'm an assistant professor at FIU in the Department of Communication Sciences and Disorders. I started as an adjunct in 2010, and I went full-time as an assistant professor in 2016. The classes that I teach there include oral rehabilitation, differential diagnosis, bilingual language development, one of my newer classes, and the research that I've been completing has been on early speech and language development for our bilingual kids with hearing loss. Bilingualism has always, for me, been a very important issue with our kids with hearing loss, because even research for children with hearing loss who are oral speakers, right, hasn't been the most research we have, but for our kids with bilingualism, I feel like there was a much bigger gap there. Now I want to see how, if they look the same, if they look different, and what's going on. So specifically what I want to know, and what's been my drive all this time, is how do our bilinguals, specifically English, Spanish bilinguals, how do these kids with hearing loss compare to typical kids with typical hearing who are also bilingual, right? So how is their speech and vocabulary acquisition the same, or is it different? And then also, what do we see by way of SES? How many adult words are being spoken, since we know that that's a big topic these days. Those conversational turns, which we're hearing more and more about being even that much more impactful. How do those things influence these kids' speech and vocabulary acquisition? So, for those of you who haven't heard it, if you've been my student in the past, apologies, you'll hear it again anyways. What do we know about parent talk, right? And we go all the way back to Hart and Risley in 1995. So this is their big study, Meaningful Differences in Everyday Experiences of Young American Children. What do we know about this study? Well, for 3 years, they went into homes every month and did a full hour every month transcriptions. They listened and recorded and then transcribed by hand everything that happened. If you've ever done that before, you're probably like breaking into like a sweat right now, right? So they did this for 42 families for children who were 7 months to 36 months of age, right? And then they spent 6 years doing stuff with that data, right? It took that long to type it, code it, analyze it, and figure out what was happening. And they coded it into nouns, verbs, all different kinds of things. And then they followed up what they learned with those kids when they were age 9. And what they found was that there was a very tight link between how well they were doing academically at age 9 with how many words were spoken to them when they were younger. Okay, so they were realizing, okay, parent talk is extremely important, right? So what were their key findings? Well, their key findings were that there were variations in children's IQ, actual IQ. Their language abilities were being partially predicted by how much talk was happening at home. Thinking, okay, parents have a lot of power, but we didn't realize just how much power their words have. Also, their academic successes at age 9 and 10 can in part be attributed to what they're hearing from birth to age 3, this critical period. And also the parents of kids who had more advanced talk talked more to their children, okay, than parents who did not talk as much and those children didn't have as much language. So knowing this, what else do we know? Well, there's a lot of variability in how much families talk to their children, right? And it could depend on maybe how many adults are in the home, how many kids are in the home, how many jobs or not are in the home, a variety of things. But we did see that by age 3, there were major differences in the child's language experiences that were found to be very significant. So some kids were hearing, by the time they were 3, as few as 9 million words total, while some children were hearing as many as 33 million words total. Okay, and so this is where that term, if you've heard it before, the 30 million word gap was coined. Okay, so we were seeing that this 30 million word gap was showing us that we had children at very different ranges and levels and had gaps that at the end of the day weren't closing. All right, so children's rate of vocabulary growth, their use of vocabulary, their IQ scores were definitely more strongly related to how many words their parents were saying to them per hour than any other variable, SES, parent education, and so on. Okay. So they concluded that with few exceptions, the more parents talked to their children, the faster their children's vocabulary were growing, and the higher the children's IQ tests were at age 3 and later. Okay. So 10 years it took to get this information, right? So 3 years in homes, 6 years analyzing all of that data, painstaking, right? So it's a hard study to replicate like that. So LENA came into play. Yay, LENA. How many of you have heard of LENA? All right, excellent. So for those of you who don't know what LENA it is, the Language Environment Analysis System, okay? And so it now becomes this small little device. Can you see if I move this? No, you cannot. This little blue device, which is about this big, gets slid into a little pocket in specialized clothing. You turn it on and it automatically records all that's happening in the day around the child. And it is able to tell us all really interesting information that used to take hours and years to calculate, okay? So it helps us analyze this vocalization and the speech language environment. So our feedback reports, when we take the data from the LENA, because it can record up to 16 hours a day, and normally we want the child to wear it all day long, so we get the 16 hours. And typically what we try to do, I know that there's been different studies that even here they've done, like say in the classroom with teacher talk. The studies I've been doing is I want them to wear them at home so that on the weekend, so we can see how much parent talk is happening. So the feedback reports give us a few things. One would be the number of adult words are being spoken to the child, right, what they're hearing in a day, so the adult word count. How many conversational turns are being taken between the child and an adult, okay? Also, how many speech-related sounds or vocalizations the child is producing. So we're getting an idea of how much they're making. Not the specific words, but different vocalizations that they're using. And then we get the automatic vocalization assessment. And that gives us an idea of how much expressive language they're using by the types of sounds they're making. And actually it will pinpoint kids that they feel are coming low, so that they flag them and say maybe there's not enough vocalizations happening here. So it's an interesting marker. And so LENA, with this new technology, set out to figure out if the 30 million word gap is still a 30 million word gap. Now that we have a new way of looking at it, what does it look like? Well, they verified several things that we learned in the original Hart and Risley study. Now, here a big difference is that they're recording all day versus just 1 hour that Hart and Risley had thought was the peak amount of time spoken, right? Now they're recording all day long. And what they realized is that it wasn't really a 30 million word gap, it was closer to a 22 million word gap. So you think, okay, great. But what we have to think about there is that that means that every single word that an adult uses with a child is now 30% more powerful than we thought it was originally, right? And you can think of the inverse as well, right? Every word that is not spoken has that much more effect, okay? So they have done some research also on monolingual Spanish-speaking families and actually many other languages as well, and they're finding that the results are holding true, and it's an appropriate measure to use as the English-speaking families that they've been using it with. So this has been a good tool that I've been able to use to look at the families who are bilingual. So I'm going to take you back for those of you who don't know where we've been as far as hearing loss and how we've moved through. So the Joint Committee on Infant Hearing in 2007 had their update on what they were telling us were best practices for children with hearing loss. So what were the principles and guidelines that they wanted for early detection and early intervention? Back in the day, when I started here in 1990, early was, 4 or 5 years old perhaps, right? And it's very much changed since then. So in 2007, they told us that the best practices would be that all kids with hearing loss should have access to resources that they need to reach their maximum potential. And they want us to follow this 1-3-6 model. And what that tells us is that by 1 month of age, all infants should have access to some kind of screening for hearing loss, okay? So if they can't, for whatever reason, in the hospital or wherever they were born, by 1 month, we want to have all kids screened. If they did not pass that initial hearing screening and a follow-up, they want them to have subsequent rescreening and appropriate audiological and medical evaluations to confirm the hearing loss by 3 months of age. Okay, so by 3 months, we want to know if there's a hearing loss and what kind of hearing loss it is, and have them in intervention by 6 months of age. So we've really moved from the 90s when I started to see where things came to now trying to really get ahead of things, right? And if we're thinking about being screened by 1 month, diagnosed by 3 months, and an intervention by 6 months, how can we now that we have technology or whatever it is that we need, how can we now still capture that critical period of the first 3 years, right? To get that parent talk and everything else they need to build their brains and to build their language capacities. So, what do we know about bilingualism in children with disabilities? Well, that's always a fun one for me, and the fights that I have and the things that keep me, roaring and fighting for as little as I am, right? We need to avoid counseling parents that if they have any type of disability, that they can't be bilingual. I hear it, I've been hearing it for a long time, and before there was a lot of data to prove it, I knew in my heart that this was not the correct thing to say, but now luckily lots of people have been doing research saying children with disabilities can be bilingual to the level of language development they can make in 1 language or 2 or 3, right? And so, and I think in some areas it's finally taking hold and it's being understood, but sometimes I feel like in the area of hearing loss, people are still afraid. They're still afraid. So very recently in my own practice as an auditory verbal therapist, one of my parents who speaks no English comes to therapy with me, and she's in the session with me, mom, child, and me, and she says, the teacher said we should probably change our therapy to English. We've been doing therapy in Spanish all along. The child is 3. And I said, and why does the teacher say that? And she says, well, because he's not speaking that much English yet in school. I said, okay. So, how good is your English today? She's like, well, I don't speak English. I said, exactly. So why, I just don't understand how that makes sense to consider that I'm going to have mom talk in a language that she is not comfortable with, that she doesn't have vocabulary with, that she is stressed out in, and that be a good situation for us to work through. I don't see how that is. I'm a mom. I talked to my daughter in Spanish until she started talking more in English, and concepts that I don't even think about in Spanish anymore. And I thought, we naturally switched from Spanish to English because she started learning more English in school and her concepts got different. And now the conversations I have to have with my daughter, who's 10, I can't imagine having them in Spanish. I don't even know if I have the words, and I'm a supposed fluent speaker, right? So these things have to be natural. And so we have all kinds of research that tells us about kids with Down syndrome, with autism, with other disabilities that is showing they can be bilingual, but we still have a lack of research that's showing what the bilingual levels are for kids with hearing loss. All right, so I'm going to talk to you actually about 2 studies, but this primary study that I'm looking at is how do children with hearing loss who are early identified by 4 months of age fit with hearing aids by 6 months of age, and if they're getting cochlear implants by 15 months of age. How do they develop their speech production and their vocabulary, and is it similar to bilingual children with typical hearing? Okay, so many of these kids are from our neighborhood, from our schools, and this is what we're seeing. So this has been the last few years of data collection, and it's an ongoing study, so we're still always accepting new kids so that we can see what we have. So far we have 22 children. 11 of those kids are kids with hearing loss. 11 of those kids are kids who have typical hearing, who have been age and gender matched within 2 weeks for our kids with hearing loss. Okay? And those kids with typical hearing have no other disabilities. We're checking them for their cognitive skills and looking at them as a group and through their paired matches. All these kids have been between 12 and 44 months of age. They are from bilingual homes where the families are reporting at least 25% Spanish input. Okay? So, in addition to that, our kids with hearing loss, like I said, were identified by 4 months of age, had hearing aids by 6 months, cochlear implants if they had them by 15 months, and have bilateral sensory neural moderate to profound hearing loss. Okay? So, what do? We're using the LENA to collect our adult word counts, our conversational term counts, our vocabulary counts, and our automatic vocalization counts from the DLPs that they wear. In addition to that, I'm collecting a bilingual phonetic inventory. We do this by listening to the actual speech recorded from the LENAs. I have my graduate students help me with this, and so they sit around the computer and listen and decide if they heard the right phoneme and do they all agree. In addition to that, we have the CASP. If you've ever used the CASP, it's an early speech production task where it's a clinician, child, and parent together working to see what their early constant development looks like. We're doing that in English and in Spanish. We're collecting their vocabulary through the MacArthur CDIs. So we're asking parents in English and Spanish, what are the vocabulary words like? Checking cognition for our kids with hearing loss and our kids with typical hearing. And then the ITMACE, if you don't know what the ITMACE is, it's a parent questionnaire where we ask the parents regarding the children with hearing loss how their devices are helping them integrate auditory information, okay, in the environment. And so I'm going to show you some descriptive statistics, some of our pair samples t-tests, and our Spearman rank order correlations. Sorry if you're starting to sweat about the stats classes you used to take. All right. So, there are the numbers. You don't have to worry about them too much. I'll explain what they mean, but some big things I want you to look at. Do I have a pointer of sorts? I'll just Vanna White. All right. So we ran some pair samples t-tests, and here's something that's very important to note that I was very, very excited to see. When we look at age, sex, SES, amount of Spanish spoken at home, the kids between the two groups, there were no significant differences. So it's not like I have a group of kids with hearing loss who are all very high SES and typical kids with typical hearing who have very low SES. No, our groups are the same. Okay, there are no significant differences between them. In addition to that, we see that our kids with hearing loss were, on average, identified by 1.5 months of age. The age they began learning hearing technology was 6 months. The ITMACE scores, it goes up to 40. The raw score is 40, and their average score, their mean score here is 35. And the number of parents in the home, which was another one across groups, was exactly the same. Okay, so our groups are good groups to compare to each other. All right, so let's take a look at some of the specific things that LENA tells us. Adult word count, conversational turns, vocalizations, and so on. So on this side, we see our kids with hearing loss. You still hear me, right? You said the microphone picks me up. And on this side, we have our kids with typical hearing. All right, and our t-value over here, okay? So we're looking to see if there's differences between our groups with typical hearing and our kids with hearing loss, right? And what we see as we go through is that we're actually not seeing any differences between the groups. We're having adult word counts. How much conversation the parents are having with their kids looks the same in both homes. How many turns are being taken between the child and the parent looks the same between the two groups. The vocalizations that childs are producing is the same between the two groups. The automatic vocalization scores looking the same between the two groups. This is very exciting, right? Would you say? I'm excited about it anyways, right? I find this very exciting. When we're looking at vocabulary, I break it down by English and by Spanish, and we're seeing that statistically it's not a difference between the number of vocabulary words I have in English versus in Spanish. This is all very exciting to me because I'm seeing, okay, we're not seeing huge gaps here, okay? Now, all of a sudden, when we get to combined vocabulary scores, we see a difference. I wonder why. I don't know, I don't have an answer. We can talk about that, maybe you have an answer. But when we talk about total numbers together, now we see a big difference, okay? And then our total number of consonants. So our kids with hearing loss are producing a few less actual phonemes than our kids with typical hearing. So you see that our kids with hearing loss have about almost 15 consonants that they're producing at this age, and our kids with hearing loss have about 17. So we see a significant difference there. Now, if I keep adding kids to this study, that might wash out, I'm not sure. We'll have to see, right? But overall, our numbers are showing that the kids are very similar at this stage. All right, so what does this mean? Currently, our young kids with hearing loss who are bilingual and are early identified, early fit, are performing at the same levels for early speech production and the number of vocabulary words in each language, right? However, we see a significant difference though in the number of total vocabulary when we combine English and Spanish together, and the number of consonants they're producing. All right. Now, we did not match our children by hearing age. For those of you who know what that means, is that looking at, we adjust sometimes instead of chronological age for our kids with hearing loss, we adjust their performance by how long they've been listening. Okay, and we didn't do that here. So that might, if we did that, maybe we would see a difference, say in consonant numbers. I don't know. It's just a guess. All right, so what I want to know is this going to keep happening, right? Is this going to stay the same over the long term? Is the gap between the total vocabulary going to continue to be gappier, right? Will it widen? Will it decrease? We're not sure. Also, can they keep the same pace, or if they don't, at some point will they level out? These are things that I want to see over time. So I'm continuing to follow these children. Even if they start to age out of my LENA data, I'm going to continue to follow them for as long as parents are willing to have us in the home, right? And seeing how they match up. And now what I'd like to show you is a study I did last summer on kids. Actually, they're not even kids so much anymore, on adolescents 12 to 19 years old from bilingual homes, okay, and see what difference there is. So last summer I had the excellent opportunity to work with two researchers from Central Michigan University. One's an audiologist, one is a linguist who does a lot of pragmatic type of research with mostly Spanish speakers. Okay, so they came down to enjoy Miami in March, and then they came back to enjoy Miami in July. So that was fun. So what did we do? We were looking at, sounds familiar, right? So we were comparing these adolescents with hearing loss who are bilingual to adolescents without hearing loss who are bilingual. 12 to 19 years old, bilingual homes. Here I had is as long as parents, there was at least one family member who spoke Spanish. Okay, they didn't have to tell us how often they spoke Spanish or not, but at least one family member had to be speaking Spanish. For our adolescents with hearing loss, identification had to be by age 2. Okay, because back then age 2 was still early. Had I asked for the 136 that we have now, we would have 0 children, okay? Also, the kids had to have hearing aids by 2.5 years of age, and they had to have for the study bilateral sensory neural severe to profound hearing loss, and use spoken language as their primary form of communication. So I was not looking at children who are using sign language as their primary form. They could know it, but I was looking for kids who primarily were using spoken language. And I had 3 kids with CIs, 4 with hearing aids, and 1 child with a BAHA, behind the bone anchor hearing aid. Ooh, lost my mind. Sorry, I swear I know what BAHA means. Okay, so what did we do for data collection? Actually, we did a variety of things, but what I'm going to show you today is what we had with the Woodcock-Munoz language survey. This is a proficiency test. It is not a language test to determine disorder or things like that, but it's a proficiency test to see how proficient you are in English or Spanish or both combined, right? And I was looking specifically at picture vocabulary, so could you name vocabulary, at verbal analogies, and at understanding directions. Obviously this was all oral directions. All right, and once again, I did the same data analyses. And so, what do we see? Well, okay, let's compare our groups. Age, no difference between the 2 groups. Sex, no difference between the 2 groups. Percent of Spanish spoken in the home, no significant differences. Number of parents in the home, exactly the same. So, we have 2 groups that are comparable in many ways, that we can make some hopefully good information from them and see how we can study them, knowing that they are similar. All right, so the mean age of hearing loss identification for our kids with hearing aids was 7 months. Not bad, not 7 years, 7 months. And the mean age that they began hearing technology was 17 months. Okay, so that's what we have here. As we move along, when we start looking at the specific data. So let me clue you in on one part at a time so it doesn't overwhelm you if it's all confusing, right? So the top part here is the scores on Spanish proficiency, and the bottom part here is English proficiency, all right? In addition to that, these are the breakdowns of the subtests, okay? So vocabulary and analogies will give us an oral language overall score, and actually analogies with understanding gives us an overall listening score, okay? These are adolescents with hearing loss and our adolescents with typical hearing. And let's look at their scores. So these are proficiency scores. So these are for those of you who know about tests, right? Where we have 100 as our mean number, right? And 15 points in either direction, right? 85 to 115 all being within normal limits, okay? That's what we're looking at. So let's start with our kids, our adolescents with typical hearing in English, okay? So when we look, we have scores 103, 101, 105, 102, 98. All sounds fairly typical, right? So typical English proficiency skills for our kids with typical hearing, our adolescents, sorry. Okay, let's take a look at our kids with hearing loss, all right? We see our scores are all mostly in the 70s. When we get to understanding directions, we're at 62, okay? Our highest score here is 80 at analogies, but none of those scores would be considered within normal limits for proficiency in English, okay? So we see a big gap. And obviously, if we look at our numbers, very significant gaps. All right, so that's English. That's our best case scenario because most of these kids are primary English speakers. Let's take a look at Spanish, shall we? So when we're looking at Spanish, look at our kids with, our adolescents with typical hearing. Their Spanish isn't great, is it? What happens?
Conversation Spanish versus academic Spanish.
Right, so are they having a lot of conversations in Spanish at home, you think? Probably not.
No.
I'm guessing the same thing happens in their homes that happens in my home. When we're talking homework and homework is in English, we are talking in English, right? When we're having the conversations I'm having now about puberty, they're in English, right? They're not in Spanish. So we have not been having these conversations, and it's showing up. We're seeing these numbers. Now when we take a look at our scores for our kids with hearing loss, our scores are in the 20s and 30s, and in understanding directions, it's 12. What happened there? We had way less conversations. Looks like we had no conversations, right? And we asked a lot of these parents, were you ever told, oh, Spanish, English, and a lot of them were like, oh, they told us that one language would be better. And oh, really? Okay. So this is just some of the information that we're getting. All right, so if you're being told that your child has a hearing loss and will have trouble learning language, make sure that they're only speaking one of them. Might as well be English because that's school, right? What does that do for our kids and their families? Many of these families don't speak very good English, right? So you have to wonder, what does that do to the relationships in the homes, right? How do you have conversations with your family and feel like you're part of the family if you can't talk about what's on your heart or the questions that you have and have an easy flow of conversation, right? And so that to me has always been something that has concerned me. It's the reason why I became a speech pathologist, even with sign language, right? I had families that would come to me in Spanish and say to me, tell my child in sign language that we're going to do this today later. And I'd have to sign to the child, oh, your dad says this and this. And they'd be like, well, why didn't you tell me before? And now I have to stand in a three-way conversation with a parent and a 14-year-old. That's, think about that. If you have kids, think about that. If you ever worked with a kid, think about that and what that means, right? So these are the numbers I want to see over time if we can avoid that. If we can avoid such huge gaps. This doesn't surprise me so much, I'll be honest, because they're not in bilingual programs for the most part. These numbers, those are huge gaps that I think are not only detrimental to family environments, like talking to grandma, right? But also future job skills, right? I don't know all of you out there, but I know a lot of you at some point, if you don't speak Spanish, have been like, who can I find that can help me right now, right? Because you've been in that situation. Job skills are needed, right? In Miami, if you want to stay here, and you have to be able to speak some Spanish. So there are those numbers. All right. I did some correlations with those same groups to see if there was a correlation between what the reported level of Spanish spoken in the home was and how their Spanish numbers came out. And actually we found that the more Spanish spoken in the home was significantly correlated with a higher oral vocabulary. That makes good sense, right? But it didn't wash out. It washed out though when it came to following directions. But if they spoke more Spanish at home, they had more vocabulary, so there's a head start. But we didn't see any of those correlations, like I said, with verbal analogies or understanding directions. In addition to that, we found no significant relationships in their proficiency in English and Spanish versus when they started wearing hearing technology for the kids with hearing loss, or the number of parents in the home. Right? I know that these are small numbers, but it's an interesting thing to look at, you know, with our kids right here in our backyard. All right, so if adolescents, here's my question, if these adolescents had been identified by current best practices, right, by the 3 months of age and started, as opposed to 7 months of age, right, and started using hearing technology by 6 months as opposed to 2.5, would the English proficiency scores be higher? Because let's go back to those numbers were in the 70s, right? And a lot of these kids are in mainstream schools and are trying to go to college, okay, with these depressed scores. So could these scores be higher in English? I don't know. We'll see, right? We've been trying to identify kids earlier, right? Get them fit with their technology earlier, start them in programs earlier. I want to follow the group that we have now and keep adding to that group to see if when they're 12 to 19, they look different. I hope they do. I really hope they do. I hope they look different than what our adolescents look like. So that's what I said about that. There are some references, and I am never ashamed to beg for more help in helping find more kids that will fit this criteria while I continue this research. Because of everyone here at UM have been definitely the driving force to help me find the kids that I need, right, and to figure out what we can do to make their vocabulary better, their bilingualism, if they're in that kind of situation, better, and to show what they can do. You know, without you guys, I wouldn't be here. So I thank all of you who have helped me find the kids that I have, but if you got some more, send them my way, send them my way. This study is ongoing, and we're gonna keep going this until we've answered that question. And if they are different, I'm gonna be very happy. If they look like my adolescents, we got a lot of work to do still. All right, so thank you very much.